Our first move for the mission is to find where our main goal started. Now, the question is, what is paraphilic disorder? The word paraphilia is derived from the Greek word para, which means around or besides, and philia, which means love. The term paraphilia has been described as any sexual interest that is outside of conventional or typical sexual interests. Some paraphilias primarily concern the individual's erotic activities, and others primarily concern the individual's erotic targets. A paraphilia is considered a paraphilic disorder when it causes distress or impairment to the individual or has caused personal harm or risk to others. Which means paraphilic disorder are group of mental health conditions that cause recurring and intense sexual arousal to atypical thoughts, fantasies, and behaviors to an individual or whose satisfaction has entailed personal harm or risk of harm to others, generally involving non-human object, the suffering or humiliation of oneself or one's partner, children, or non-consenting person. Let's proceed to the main goal of our investigation, which is the voyeuristic disorder. A voyeuristic disorder is also called voyeurism, but they are not entirely the same. Voyeurism does not involve engaging in sexual action with the object of the observation. Rather, it involves the act of watching, peeping. Also, they do not pursue sexual relation with the individual who they are watching. Someone with voyeurism might have urges and thoughts of watching an unsuspected person. However, they don't usually act on their impulses. The voyeuristic disorder is a category of paraphilic disorder. This disorder causes a person to have intense and recurrent urges to watch non-consenting person who is disrobing, naked, or engaged in sexual activity. Also, it causes significant distress and can limit a person's ability to function. It typically develops in adolescence or early adulthood and is more common in men than women. Sign and diagnosis for voyeuristic disorder. First, patients have been repeatedly and intensely aroused by observing an unsuspected person who is naked, undressing, or engaging in sexual activity. Arousal is expressed in fantasies, intense urges, or behaviors. Second, the individual has acted on these sexual urges with non-consenting person, or the sexual urges or fantasies cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Third, the condition has been present for over a period of at least 6 months. Fourth, the individual experiencing the arousal and or acting on the urges is at least 18 years of age. Now, what can be the causes of this disorder? After doing research and finding clues about voyeuristic disorder, I found out that there is no specific causes of this disorder. But certain risk factors or reasons can increase an individual's potential to develop the voyeurism disorder. Now, let's talk about the treatment of this kind of disorder. Similar to the majority of other psychological disorder, voyeuristic disorder is curable if the person is motivated to stop the voyeuristic behavior. The important thing is to identify when you are in need of help. People with this disorder, as with other paraphilic disorder, are fearful of being judged, embarrassed, or feeling humiliated as the thought of speaking to anyone about it, even a therapist. This leads them to not seek help, and often the disorder will become worse or other paraphilias and or mental health issue can develop. Voyeuristic disorder treatment by a qualified therapist who specializes in sexual issue can help by introducing ways to control desire, exploring health outlets when triggers or urges occur, addressing and correcting thinking errors and negative thoughts, recognizing places or circumstances that would increase the probability voyeuristic behavior may occur and how to change this. Psychotherapy, cognitive behavior therapy, or CBT can help with learning skills to control urges and learn why voyeuristic behavior are unhealthy. Voyeurism treatment can introduce appropriate coping mechanism to assist with fighting voyeuristic sexual desire. Voyeurism treatment helps the individual develop insight toward the root cause and thinking error that promote voyeuristic behavior and assist them with making positive change. In medication, there is antidepressant can help with co-occurring mood disorder such as depression or anxiety, while simultaneously lowering sex drive. A lowered sex drive can help with the impulsivity associated with voyeuristic thoughts and behavior. However, without therapy, this does not directly address the voyeuristic urge. Another medication, anti-androgens, member of a class of drugs that can be used to temporarily lower circulating testosterone levels. Doing this reduce sex drive and allow for more effectively therapy techniques and cognitive restructuring. Remember, voyeuristic disorder happens when a person becomes sexually aroused while observing unsuspected others. When they see someone undressed, naked, or engaging in sexual behavior, they become aroused.